um, immune system video, and we're talking about some clinical conditions here. And these are some things that students often seem to get confused, so I want to really make a clear distinction here. So let's talk about autoimmune diseases first. And this is when the body makes antibodies against one's own tissues. So body makes, make it a little bit bigger, I guess. Make it so you can read it. Against self. This is the immune system gone wrong. And we've got several different conditions where this can happen. We have autoimmune thyroiditis. I want this smaller as it was before. There's thyroiditis, which will then lead to hypothyroidism. We have rheumatoid arthritis. We have insulin-dependent diabetes mellitus. This is when a person has diabetes because their body has made antibodies against their own beta cells and have destroyed their own beta cells. Therefore, the body cannot produce insulin and is dependent upon insulin to be administered either by injection or by a pump. So that's insulin-dependent diabetes mellitus. Another example would be multiple sclerosis, MS, and many, many more. I'd say at least 50 or 100 more autoimmune diseases. The body makes antibodies against self cells. Now, immunodeficiencies is a deficiency of the immune system. This is not autoimmune disease. This is different. This is the body is deficient or failing because of HIV, human immunodeficiency virus, which would produce AIDS or can produce AIDS. It will cripple the immune system, particularly attacking CD4 cells. And we remember that CD4 cells are essential for both cell-mediated immunity and antibody-mediated immunity. Another thing that can cause immunodeficiency is chemotherapy and radiation, because again, this will destroy the immune cells. It destroys rapidly dividing cells. And then immunosuppressive drugs do the same thing. Those are immunodeficiencies. And then we have allergies. Allergies, as your lecture notes say, would be an inappropriate or excessive response to antigens. Okay. And we give an example of an immediate hypersensitivity reaction, or a type 1 immediate hypersensitivity reaction, and I describe it in your lecture outline. Let's just go type 1 hypersensitivity. We'll just quickly outline these steps. And that would involve sensitization. And that is when you first are exposed to the antigen. So sensitization when exposed to the antigen, and that will lead to production of large amounts of IgE, the IgE attaches to basophils and mast cells. Remember, basophils are in the blood and mast cells are in the tissues. And then upon second exposure, you have the antigen binds to the IgE on the mast cells, and we know then that that causes release of histamine, heparin, and cytokines and prostaglandins, and that will then result in inflammation. And we know that inflammation will give you many of those symptoms. It can be local or systemic. And if it's systemic, you have anaphylaxis, which is a type of shock in which the mast cells throughout the body will release a lot of histamine, and it will cause a serious reaction. And that leads to swelling, edema, welts, respiratory smooth muscle contraction, and that means you can have asthma, you have an inability to breathe, you'll get a drop in blood pressure, and the patient will go into shock. And of course, our drug of choice would be epinephrine, because epinephrine will cause vasoconstriction and will increase blood pressure, and it will deal with all this inflammation. It will help the heart to pump more effectively, and will generally promote the blood vascular system to get you out of the state of shock. Oops. Okay. Vaccines are another example, another important thing as far as the immune system, and we've talked already a little bit about vaccination, but we won't be going into that to any degree at this point. We know that the memory response is what's very important, the anamnestic or memory response due to these memory B cells and memory T cells. So this is a little question just asking you about which is not an autoimmune disease. Okay, and I'll let you look at that and figure that out. And this is just a slide that is telling you that the most common type of allergic reaction is a type 1 hypersensitivity, which is an inappropriate or excessive response to antigens. And we just talked about that with these steps, the sensitization, leading to the lots of IgE being produced, which then attaches to basophils and mast cells, and then later on the antigen in the second exposure will bind to the IgE on the mast cells and cause release of histamine, heparin, cytokines, prostaglandins, and cause lots of inflammation, which can result either just in local inflammation or anaphylaxis, and that is when we get a general release of histamine throughout the body, causing all kinds of problems. So, that's it. Thanks for your attention.